To earn a distinguished grade on this assessment, your goal should be to align every paragraph with the grading rubric rather than simply answering the questions. Although the paper is only 2 to 3 pages long, it forms the foundation for the remaining assessments in the course. The healthcare economic issue you choose here will later be explored through a needs analysis, cost-benefit analysis, and policy advocacy. Choose a topic that is relevant, supported by current research, and meaningful within your current or desired healthcare setting. Begin with a concise introduction that identifies the healthcare economic issue and explains why it is important. Briefly describe the community or population most affected and explain that healthcare economics influences patient outcomes, organizational performance, and the allocation of resources. Keep the introduction focused and avoid unnecessary background information. Next, describe the healthcare economic issue in detail. Do not simply state the problem. Explain what it is, why it exists, and how it affects a specific population or community. For example, if you choose inadequate staffing, discuss how staffing shortages increase workloads, delay treatment, reduce patient safety, and contribute to burnout. Support your discussion with current statistics, public health data, or findings from peer-reviewed journal articles. Strong papers rely on credible evidence instead of personal opinion. After describing the issue, explain why you selected it. Your rationale should go beyond saying that the topic is interesting. Discuss why it matters professionally, why it deserves attention, and how addressing it could improve patient outcomes and organizational performance. If you currently work in healthcare, relate the issue to your professional experience. If not, explain why it is important within your desired career setting. The next section should explain how the issue affects multiple stakeholders. The rubric specifically requires discussing its impact on your work, your colleagues, your organization, and the surrounding community. Avoid focusing only on patients. Explain how the issue influences staff workload, financial resources, operational efficiency, and the quality and accessibility of care. Addressing each stakeholder demonstrates a thorough understanding of the economic issue. You must also identify the gap contributing to the problem. A gap is the underlying factor allowing the issue to continue. It could involve inadequate funding, ineffective staffing policies, poor resource allocation, limited preventive services, or barriers to accessing care. Most importantly, support the identified gap with at least one scholarly source, public health report, or peer-reviewed article. Although only one reference is required, using several recent scholarly sources will strengthen your paper and improve its credibility. Conclude by summarizing the importance of addressing the healthcare economic issue and the identified gap. Reinforce how solving the problem can improve patient outcomes, strengthen organizational performance, and benefit the community. Do not introduce new information in the conclusion. Before submitting, confirm that every grading criterion has been fully addressed and ensure your paper follows APA 7th edition formatting, including a title page, headings, in-text citations, and a correctly formatted reference list. If you found this guide helpful, subscribe to the channel and share this video with classmates who may benefit from it. I regularly post assignment guides and academic writing tips designed to help students earn top grades. If you need personalized help with this assignment or any other coursework, use the contact link in the video description. Thanks for watching, and I will see you in the next video.